Hey everybody, welcome back to the channel. My name is Reed. Don't forget that you can download the PDF of this document down in the description below. And don't forget that if you enjoy this content to like, comment, and subscribe. So let's jump into it. So we've got a Holter monitor here. And a Holter monitor, remember, is a wearable device that records cardiac rhythm at all times. It helps us find moments where, oh, that might be the rhythm that is causing you your symptoms that needs to be fixed. And so we have a strip that is continuous through. And so let's kind of talk about what we find. So what you'll notice is we've got this sinus rhythm. It's a narrow complex rhythm here. You can see that there are P's that conduct that narrow complex QRS. There is one P for every QRS. That tells me that things are seeming to work out well, right? And you see it's a pretty regular rhythm. And the rate of the rhythm, if I start here at a solid line, is 300, 150, 175. This will be 60, so probably 70 beats per minute. It's a normal rate. And then all of a sudden, you'll see as we keep going, you see all of a sudden we get these long pauses, right? And the rhythm essentially is cut in half, maybe. And so let's see if we can measure what the intervals would be here. We have 300, 150, 175, 60, 50. This is like 43. And so we're down now in the mid 30s beats per minute all of a sudden. So that should make you think in your mind, right? When the rate splits into 1/2 all of a sudden, you should think, I wonder if we've got some type of AV block, right? And so here I see, let's take a look. So we've got our normal P's to our QRS, our normal P's to our QRS, and then we have a P that does not conduct to a QRS, right? This P is blocked. And then we have P QRS, P that is blocked, P QRS, P that is blocked. And so we get this pattern, and you can see that pattern continues all the way through this bottom rhythm all of a sudden. So we've got some type of definite AV block, right? There is a blocked P wave. First thing we need to do is we need to make sure that these P waves that are blocked, we need to make sure that they come on time. Meaning we need to make sure that they're not PACs. So we need to rule out PAC, because sometimes a PAC can be a blocked PAC, right? So if you've got like normal sinus rhythm where you've got your sinus node depolarizing the atria, AV node captures that signal and comes down. Well, if you get a PAC that depolarizes the atria in the AV node, if the AV node has not recovered yet, then it'll get blocked at the AV node, right? So you'll just have a P wave by itself. So sometimes we need to make sure that these P waves are on time. And so what you can do is you can maybe draw a line between these two P waves. You can measure it out, or you could just see exactly kind of in the middle. So if I draw a line in between them, I would expect my next P wave, if you look at that, it's right in the middle of those two, right? And if you wanted, you could measure, and it would notice that it is kind of right in the middle. So this P wave is on time, and so are the other P waves. So that tells me that we now have degraded down into some type of second degree AV block, right? Because second degree AV blocks are when not all P waves conduct to a QRS, but some of them do. We know that second degree type 1 is a disease where the P waves will get longer, 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 longer until they drop. And we know that type 2 is when they stay the same and then they drop. So luckily, we actually have a strip of what is going on before the drop starts. So we can look. So we notice that here, our PR interval looks to be right about a little less than 200, maybe 180 millisecond PR interval. We can look at this PR interval. Appears to be the same. This PR interval is the same. And then we get our dropped beat, and the next PR interval is the same as normal. So what you're noticing is that before these beats started dropping, the PR interval stayed the same. And so that tells me that this patient likely did not develop a second degree type 1. So remember, type 1 second degree blocks, PR interval increases until it drops. And type 2, the PR interval stays the same until we have a drop. And so because we have the beats that go on before this, we can see, is there evidence of that decremental conduction that we see in type 1, right? That's decremental conduction, is when the PR interval is getting worse and worse and worse. And so that's designating these two is very important. So because of what we're talking about, this is a type 2 AV block, right, with a normal sinus rhythm. So this individual developed the worst form of the second degree AV blocks, which is the type 2, where we see that the PR interval stayed the same before it dropped. And so that usually indicates a block at the kind of that His junction. And so that is a little bit more dangerous rhythm, right? Because if that progresses to a third degree AV block, and if that His bundle is blocked, then this person cannot create a junctional rhythm. So I hope this video helps. If you have questions about rhythm strips, Holter monitors, please ask. Please, if you don't feel comfortable, go to my ECG masterclass playlist, and we've got all the AV blocks noted in there. You'll see that there are different terminologies for second degree AV blocks. It's important to speak the right language. So, alrighty, we will see you on the next video. Thank you so much for watching, and have a great day. Take care.